And it is April 16th, 2025. I'm on an elective rotation. I'm very happy. I'm motivated. This is a rotation which I am given a little more autonomy. So that's nice. I love it because I can do like my own thing. Of course, if I'm doing anything wrong, someone will tell me, but I just wanted to share with you an important point, which is when you get a sign out and you get the option of admitting a patient and you get the sign out from the emergency department, read it. Yeah, read it. But don't anchor yourself to that diagnosis. And I'll give you a quick example. We had a patient that the ED told us that the patient was being admitted for chest pain, and it seemed like chest pain ruled out, and that the patient had to be admitted to the chest pain unit. And basically, I went in there open minded and I analyzed the case, and I was in there for quite a bit. But in the end, I thought to myself and was like, what if this chest pain is not originating from the heart? What if this chest pain is coming from something else? So, what happened? Well, I started asking and asking, and I got to the conclusion that this actually was not cardiac related, but actually a very big hiatal hernia the patient had, and the pain was due to that. Of course, the patient had several risk factors, which, if we just ignored the heart, it would have been a problem for us and for the patient. So yeah, we went ahead and we ordered some cardiac things, but it was lower on our differential. And we explained this to the patient. We adequately noted or charted this on file. We explained our reasoning so anyone that read the file would understand why we were doing this, why we were doing that. And we were very clear on the orders we were putting in. What was interesting is that when I left the room, I felt like, yeah, I think my differential is solid. I was pretty proud of how I rearranged the problem list. Actually, now the hiatal hernia became problem number one, and cardiac associated pain became lower on the list. And it was good to to know that I left, and within 30 minutes, the nurse had given the patient a little bit to eat, and the patient started having the chest pain. And actually, the patient was having solid foot dysphagia. So all these things were pointing towards the chest pain. It was the exact same chest pain after eating and with dysphagia. So remember that in medicine, whatever can, Occam's razor is whatever can explain the whole thing the best is probably gonna be your diagnosis. It's very improbable that you have four different diagnoses going at once, as opposed to one syndrome explaining the entire clinical picture you're seeing. So that was nice. And I'll tell you another brief example that happened actually the day prior to that. I had a medical student, and actually, it was the first day of this medical student in clinical medicine. And I told him, okay, you're gonna learn a lot today because, well, I pride myself in applying the clinical aspect and making sure whoever I have to teach that day actually gets their money's worth, right? Well, no one is paying me for teaching, but I I was in their position. It doesn't make sense just someone rotate with you just for the sake of it. If someone's gonna rotate with you, make sure that they end up a better clinician at the end of your encounter with them. That's the idea of life, right? Giving back. So what I did is I told them before we went to see the patient, I told them, remember, a good doctor is a good detective. You have to be a good detective to be a good doctor. When we saw the patient, and the patient had first and last name, the patient didn't want to talk much because the patient was pretty sleepy. And I actually told the student, like, that's it. I think let's better let the patient, we're going to let you rest and we'll come back later. We're just going to listen to your heart and lungs in this. But something, I just said to myself, like, let's just complete this medical information. So I asked the patient, okay, so, and we're just going to probably tell me about your past medical history. How are you doing with the pacemaker? And the patient told me, no, I don't have a pacemaker. And I'm like, oh, okay. I wasn't judgmental. But interestingly, when I got the sign out, it said the patient had a pacemaker for many years and had heart failure. And I'm like, okay, okay. And then I asked the patient, read the patient their full name with their middle name. And the patient is like, no, that's not my middle name. And I'm like, okay, but is this your first and last name? Yeah. And your middle name, isn't it this? And the patient is like, no. And I'm like, maybe this patient just doesn't like their middle name, right? And then I just asked a couple more questions. And I asked the patient, have you ever been in this hospital? And the patient is, never in my life. I'm like, okay, how old are you? 40, I'll say 49. And I'm like, okay. And the patient on chart we had was same name with a middle name, had been in the hospital many times, had a pacemaker, and was like a couple years off from what this patient was saying. So then I was like, okay, I checked the full orientation. The patient was oriented, and I'm like, okay, okay. So what had happened? This patient had been in the emergency department for many hours, and labs were drawn, and they were charted under such patient's name. It wasn't that patient. It was another patient. So we detected it, and that's being a good detective. You just have to question things. You have to go and look things through. You shouldn't just blindly accept any information given to you. Remember, there's human error. As long as you go in your medical career, you'll start seeing that, oh, this person I really trust. Like, whenever I see a note from such and such specialist, I'm like, this needs no questioning. Like, this person is legit. It's like, whatever this person said, I trust. But you always have to probe it a little. You never want to anchor yourself, right? But for most encounters, you have to question most things, not because you're mistrustful, just because you want to treat the patient as if they're your family member. What would you yourself want if you're in the hospital, or your family member want? That you are inquisitive and you question everything. Why? Because ultimately the truth will set you free and make you healthier. So that's it for this one. See you in the next one. Peace.